How likely are you to get sick after getting fully vaccinated? Dr. McGeorge is in with new data that may come as a surprise. We've heard the Pfizer and Moderna vaccine had efficacy rates in their initial trials of roughly 95%, offering excellent but not perfect protection.
And now that the vaccines have been given to millions of people, there really is more real-world information on their effectiveness. Dr. McGeorge is here now with more on what we know about the effectiveness in Michigan. Doc?
Yeah, Jason and Sandra. So early on, there were sporadic reports of vaccine breakthroughs. Those are people who developed COVID despite being fully vaccinated. But now, more consistent data is being collected. For example, Washington State reported about 100 COVID cases out of 1.2 million vaccinated people. Minnesota, they've seen 222 cases in 1.8 million vaccinations. Here's how Michigan is doing so far.
From the start of the year through March 31st, the Michigan Department of Health and Human Services has identified 246 fully vaccinated individuals who have contracted COVID-19 in Michigan. These are people who had a positive test 14 or more days after the last dose in their vaccine series. In that same period of time, roughly 1.7 million Michiganders completed their COVID-19 vaccine, meaning the 246 cases represent 0.01% of those vaccinated.
It is not a failure at all if someone does get COVID-19 after they've had the vaccine. They're likely going to be not as sick, and they're also likely going to not pass it to other people who can also get very sick.
Currently, they have only completed investigations on 117 of those cases. 11 of those people were hospitalized and 3 died. The significance of that is that we have often said of the vaccines that they were completely protective against severe disease and death in their phase 3 trials. What this shows is that when you look at the effect in millions of real-world cases compared to the tens of thousands in studies, you will find some exceptions that occur at a very low rate. These vaccine breakthroughs are identified through weekly reviews of all cases of COVID-19 reported to the Michigan Disease Surveillance System and comparing them to records of all people who have been fully vaccinated. These efforts are part of an ongoing larger CDC monitoring of vaccine efficacy.
Now, I want to emphasize, these findings are not surprising, and the vaccines continue to significantly reduce your risk of getting sick, being hospitalized, or dying, but they also support the reason that masks and distancing are still important in public places until we have far more people vaccinated.
And Doc, you know, we've heard concerns that some of the variants might escape protection from the vaccines. Do they have any handle at all on that?
Well, you know, Sandra, that is being actively investigated. Specifically, if there is any available specimen from a breakthrough case, it is forwarded to the state lab for additional testing, including the whole genome sequencing to determine if it was related to an infection with a variant of concern. So, yep, they're looking at it.
All right. Thank you so much, Doc.